So you're looking for data on healthcare in the United States. We can help. The collection of healthcare statistics has actually been kind of important for quite a while, at least going back into the 1850s with, for example, Snow's cholera map, in which he was able to use the location of deaths by cholera around a particular well in London to link cholera as a waterborne illness. The Florence Nightingale data, in which she collected causes of death in the hospitals in which she was a nurse and an administrator, showing that the cause of death from being wounded in action was relatively low. It was actually post-operative infections that were causing the majority of the deaths. And so much so that she was able to establish a new kind of hospital care with a standard of hospital care which is basically pretty close to what we have today. In 1870, the Census Bureau was collecting these kinds of data, epidemiological data, with, for example, the map that we published in the 1870 Census Atlas on the deaths through malarial disease. And there was also this chart on deaths by specific causes in specific states within different age groups. There were many different kinds of death statistics which we were collecting at that time. Now, in the 20th century, other agencies of the federal government as well as the states have come in to collect these kinds of epidemiological statistics. For example, this incidence of Rocky Mountain spotted fever and case fatality data that go back to 1920 from the Centers for Disease Control, as well as their excellent chart on the true death rate for all infectious diseases in the United States during almost the whole of the 20th century, from 1900 right through 1996, showing important events such as the influenza pandemic and the introduction of penicillin, driving those death rates down. Now, the Census Bureau still collects a great deal of data that are important for health statistics and the understanding of the provision of health care, in particular about health care access. For example, in the current population survey, we collect data on the rates of health insurance coverage on a national level, broken down by some particular groups. You see here the number of uninsured and the uninsurance rate from 1987 through 2011. Numbers in millions, rates in percent. These kinds of data can give us a national picture of what's going on. If you're interested in smaller geographies, we have the American Community Survey, as well as the Small Area Health Insurance Estimates Program. Both of these provide health insurance coverage rates on smaller geographies. The American Community Survey can go down to the block group level, for example. The American Community Survey can also be useful for providing data on healthcare provision, not access through financial means, but the provision of doctors and nurses. Are you living in an area where there are doctors and nurses who can treat you? We have additional data sources which are even more direct on this point. And then we go over there. For example, using the data from our County Business Patterns program, we can create a map showing where the doctor's offices are in the United States and then relate those to population figures to produce the number of people per doctor's office by county and counties with no doctor's offices. So, for example, I can show you counties in Ohio and Kentucky with a population of over 10,000, but with not a single doctor's office. These are areas which we believe have lower access to health care facilities. The question of people per doctor's offices actually raises an important point. A lot of the data that the Census Bureau collects is useful and informative of health care services. Whether it's the size of the population, the size of the elderly population, male, female, race, Hispanic origin. A lot of what we collect is actually predictive of different kinds of ailments and different kinds of requirements for medical care. The work that other agencies are doing in modeling where we're going to need hospitals and where we're going to need medical services provided in the future, a lot of it comes from the Census Bureau data. We've got data on other things too. We've got all kinds of surveys. The Survey of Income Program participation, for example, has a question on how many times you've been to a doctor's office in the last year, your basic state of health. There's a lot of data, and I hope that you'll find it on this website.